Hi, I'm Dr. Joe Childs. I'm a board-certified chiropractic neurologist, and the purpose of this short video today is for you to have a better understanding of how to look at x-rays and understand what's correct with your x-rays or what's abnormal with your x-rays. If you're watching this video, you've already have come to our office, you've had a neurological examination, you've had your x-rays taken, now you're home and you're watching some of the videos to help you better prepare yourself for us to go over your findings and let you know if we accept your case. So this video is going to be a short video. We're going to go over x-rays. Now remember, there's three types of care that we do in our office. We do neurological based care, and that is dealing with the central nervous system, the brain, and the spinal cord. We also do metabolic care. Metabolic care is specific types of nutritional protocols based on specific lab panels. And the other type of care we do is biomechanical care. Now, the videos that we gave you for either, they're the symptom-related videos, the one for fibromyalgia, the one for vertigo, or let's say MS, or whatever you came in with, watch that video. They're going to go over the specific metabolic and neurological treatments. This video I'm going to go over, again, x-rays and the biomechanical care. Now, when you look at the spine, just like when you look at blood work, there's normal levels for cholesterol, there's normal levels for when you look at a complete blood panel, when you look at your thyroid, all these different things, liver enzymes. Well, in biomechanics, there's a normal or there's an optimal for the spine to be in. And an optimal position for the spine to be in is nice and straight from the front. You should have a nice straight configuration from the front. Remember, we checked your posture when you came into the office, and you should have good, healthy, nice straight configuration. Spine's going to be real strong. It should not be bent out of alignment in any way, putting pressure on the joints, creating uneven loading. Now the other thing is, from the side, you should have three curves, one in the neck, one in the mid-back, and one in the low back. They should be 363-degree arcs. That is ideal for the spine. Patients that have that normal spinal position, their spine's going to last a real long time. It's not going to develop the arthritis and the degeneration. But as we go through life, what happens is we tend to lose the normal structure in our spine. The reason why we do is we tend to absorb forces. I mean, just gravity will cause us to push forward, and we'll tend to go forward like this. Patients that have jobs where they're looking at computers all the time, people that sit for long periods of time, people that have a lot of physical stress, sports injuries, car accidents, you name it, all the different injuries that you've had and the repetitive stresses that you've had in a lifetime, they add up and they cause the spine to misalign. Now these misalignments are called subluxations, and we're going to go over specific x-rays so you can really understand when you come back and you look at your own x-rays, you're going to be able to point right out and say, oh, Dr. Childs or Dr. Durr, I see where and the reason why I have this problem. I can see that my discs are degenerating in this area. Okay? So again, spine should have three curves from the side, and you can look at it right here. It's in every anatomy book. You should have a curve in the neck, curve in the mid-back, and a curve in the lower back, and the spine should be nice and straight from the front. Now, what causes it to go out of alignment? We talked about all the physical stresses, but even mental stress. A healthy brain, when the brain is really firing and functioning at 100%, the spine is going to maintain its normal curves, because the brain is what controls all the muscles and controls all the ligaments and controls all the nerves that actually hold your spine up straight. So it's vital to understand that when you have mental stress, that can also cause you to lose your posture. And then metabolic stress. So the metabolic care, the biomechanical care, and the neurological care all work together in you having a healthy spine that's going to allow you to have the best quality of life. So what I want you to do right now, or what I'm going to do right now, is I'm going to have you sit down and relax. What we're going to do is we're going to zoom into a TV where you can actually see these x-rays nice and close up, and I'm going to go over all the different x-rays that we took, and I'm going to show you some examples of corrections, pre and post corrections of patients that just started care and patients that went through a corrective care program and were able to improve the structure of their spine. Okay, now right now we are going to go over some x-rays just so you can get an understanding of what a normal spine looks like versus an abnormal spine. And we got you zoomed in here, so you're not really going to see me, you're just going to see my hands and me pointing out normal. So here's the deal. Basically, when you look at spinal x-rays, first thing we're going to do is we're going to look at the side view. We're going to look at the side view of the neck, where you should have a nice normal curve. So this is the normal spine, and when you look at the normal spine, it should have a nice curve in the neck. So we're looking at the neck, side view of the neck, and there should be a nice open disc spaces. Now, disc spaces are, the discs are the cushions that are between the bones, and they provide space between the bones so the nerve can exit out. And that nerve can go to muscle, it can go to your organs, it can go to, you name it, it can go to any part of your body. And so when you have good open disc spaces, you're going to have nice open areas for these nerves, or spaces for these nerves to go out, okay? So that's normal. But what can happen is we can start to lose the structure, and we're going to go over the causes of what causes this to happen. And so that's what we call phase one. Phase one, we now lose the curve in the neck, and so the black line is where the patient should be, the red line is where this patient was. This was a patient with migraine headaches, a young girl. But what now that does is when you've got this curve in your neck, what that creates is it creates more pressure or loading in the back of the spine instead of the front of the spine. Now, the joints in the back are supposed to take up the weight of your head, where the joints in the front are for movement. And so what happens is when you lose that curve in your neck, it'll start putting more loading on the front. And when you have more loading on the front, over many years, if you don't have that corrected, you go into phase two. Now, in phase two, what happens is the disc spaces start to get really, really thin. So instead of having nice, big, healthy disc spaces like so, like you have in the normal one, nice open spaces, which are these little black areas in here, right? What happens is the longer you're in phase one, eventually you go into phase two, and in phase two, you start developing discs that are severely decayed and degenerated. And so instead of having nice space between the bones, you got these discs that are falling apart in here. And what that does is it narrows the space where the nerve exits out, and what that creates is it creates a host of problems, and can cause chronic pain, it can cause pressure on that nerve, you can have all kinds of issues. And then we go into phase three, and in phase three, what happens here is you'll see you should have a good curve here. Well, this is the red line, and so you can see in through here that the discs are in really bad shape. Phase three means that it's almost bone on bone, and that's called arthritis or degeneration. It's really the same word or the same term, but this guy came in and he had chronic neck pain. He had pain down into his arms, numbness in his arms, because the nerves that came off of here go down into the arm, okay? So let's look at normal versus phase one here. So this is normal. That's the way the spine should be. And again, the discs are nice and open in through here. That's healthy. And that person's spine is going to stay healthy through a lifetime if they maintain it. Now this is phase one, and you can see the poor structure, loss of curve in the neck. And this patient was a 15-year-old girl with chronic migraine headaches. All right, and so you can see that she lost that curve. Now, why does she have migraines? Does she have migraines because she is not taking enough medication? No, she has migraines because of the fact that she's got pressure on the discs and the joints and the nerves. And most people's headaches and migraines have there's a big component to the cervical spine that it's causing them. So that's the way the spine should be, and she was like that. Turned out she was in a car accident, and that's what caused that. This is a phase two. That's normal. Phase two, you can see now the discs are getting real thin in here. This was a patient who had chronic neck pain. She had pain down into her arms and pain into her shoulders because the discs were getting degenerative. They were getting small, and so they were putting a tremendous amount of pressure. This is the phase three, and the phase three, I mean, this is almost permanent. This is permanent at this point. We can't fix phase three. And we can make a person feel better in phase three, but when they're in phase three, this is severe degenerative changes. This is years of poor spinal structure. And a lot of people will say, well, oh, isn't that just old age? Well, this guy was about 75 when he came into the office, and everybody says, well, it should be just old age, right? Well, if he's 75, then these bones that are degenerated are 75, right? The ones that are like that. And the ones that up top, where actually the curve is going in the right direction, they're nice and open up there, right? And those bones are 75. So the question is, these bones are 75, these bones are 75. How come these aren't degenerated and these are? The reason why these are degenerated is because of the loss of structure in the curve in the neck, and that made these bones degenerate faster. Okay, so proper structure equals proper function. This is a study. Loss of the cervical curve stretches the spinal cord 5 to 7 centimeters and causes disease. And that's Alfred Bragg. He's a neurosurgeon who is also a Nobel Prize recipient and did a lot of research on the brain. He says it actually stretches the spinal cord. So if we look back here, the curve, when we have a nice normal curve, there should be a nice the spinal cord. So this is a cross section. These are studies of cadaver studies. When you have a good curve, there's ample space for the spinal cord to come through. When you have loss of structure and poor alignment, the discs degenerate and they bulge in and put pressure on the spinal cord, which will shut down the messages coming from the brain to the body. You got to remember, the spinal cord transmits messages from the brain to the body and back from the body back to the brain. So this person has decreased electrical current, a decreased function coming down through their spinal cord, and they have pressure because of that disc bulge. And the longer it goes, the more degenerative changes occur, and you can see even more and more pressure. These are actual cadaver studies. This is a phase 3, and you can see how much pressure is on that spinal cord. This person has a very poor quality of life when they're like that. So let's continue along. Again, here's more studies when you have that loss of curve. Again, here's another example of an MRI. This is a bulging disc. These discs bulge back into the neural canal and can shut off life and information flowing through, and you may have anything from poor function of your organs, your heart, your lungs. You may have numbness and tingling in your extremities. These are all possibilities. All right, so there's an example of a disc bulge putting pressure into the spinal cord. Okay, that's what occurs when you lose the curve. Now we also have what's called forward head posture. Forward head posture is another type of subluxation. It's along with the loss of curve, and when it gets really bad, this is normal. You should have that nice good curve in your neck. This is somebody with forward head posture like this, and this is somebody with severe forward head posture. I mean, they're really hunched over, completely hunched over. And I'll give you an example. I have a poster to show you. This is posture decay. Okay, you can see normal would be like this guy here. This is somebody moving into poor posture, and then this is somebody that has completely lost the normal position of their spine, and that's what it looks like on X-ray. These types of patients have severely, they have poor energy. They have, they just don't function well because their head goes so far forward. So this is an example of forward head posture. It's been studied that forward head posture can cause headaches, neck pain, TMJ, arm pain, degenerative arthritis, thoracic outlet syndrome, which causes numbness and tingling in the arms, stretched spinal cord and nerves, which we talked about, deformed ligaments, muscle spasm, stretched blood vessels, and it causes the discs to decay. This happens more rapidly in a patient that has this going on. Progressive forward head posture syndrome. For every inch of forward head posture, it can increase the weight of the head on the spine by an additional 10 pounds. And that's Physiology of the Joints, Volume 13. Forward head posture leads to long-term muscle strain, disc herniations, arthritis, and pinched nerves. That came from the Mayo Clinic. They came and they've done studies on forward head posture. So we got to correct that. So here's an example of a correction. The person had this forward head posture. This is where they needed to be. This guy worked on a computer all the time, and so he had this forward head posture that developed over years of working on a computer. This is our post-X-ray, and so now when he stands in front of the X-ray, he stands perfect like this without any muscular effort, and that's a correction. Now, here's another one. This guy had severe disc damage in his neck. We did spinal decompression therapy and corrective care, and that's a pre and a post-X-ray, and that's the changes that we made with that patient. This guy got out of his neck pain, he got out of his disc pain, which was causing pain down into his shoulders and arms. If this doesn't get corrected, this was the first correction I showed you with forward head posture. If that doesn't get corrected and the person goes many, many more years, this person is going to move from that to that. So the person is going to go from looking like that to eventually looking like that over many years because subluxations are cumulative. This is a spinal curve correction. This is the girl with headaches, chronic migraines. This is our post-X-ray. Her migraines were gone after that. This is a patient, and I already showed you this curve in the neck. She had chronic disc problems. We restored that arc back in her neck, took the pressure off the spinal cord, and she's doing a lot better. Her neck pain went away. This is another, from the front, the spine should be straight. This guy was in a wheelchair. The spine should be straight, okay? And his spine went off to the right. Now, he didn't have paralysis, but he had so much pain that he barely could walk, this guy, when he came into the office. So he actually arrived, and we got him to a walker and actually to a point of not needing any of that. He had chronic pain down into his legs, stiffness in his legs. He had what's called spinal stenosis. And this is our pre- and post-X-ray. We improved his structure that much, and he improved dramatically. Proper structure equals proper function. This is a little boy with asthma. He had big misalignment up here in the upper neck area, which was putting pressure on the spinal cord and the nerves up there. We restored that structure in through here, and his asthma went down dramatically. He got to the point where he didn't need to use his inhaler anymore. Now the lumbar spine, we've got the same thing, phase 1, 2, and 3, and normal. And this is pictures of the lumbar spine. We're looking at the spine from the back straight on like that. The spine needs to be straight. When the spine's misaligned, it's going to do the same things to the discs. Here's an example. We call this a right thoracic shift. It means that person's spine shifted to the right. This is why we look at your posture in the exam, because we can see, do you have any shifting? What that does is it creates more loading. Posture affects and modulates every physiological function from breathing to hormone production. Spinal pain, headaches, mood, blood pressure, pulse, and lung capacity are among the functions most easily influenced by posture. That's the American Journal of Physical Medicine. They did that study. When you're shifted to one side, it puts more loading on one side than the other side, and it's eventually going to cause the discs to bulge and degenerate. Okay? Here's an example of a correction. This person had a shift to the left, basically a scoliosis in the spine, and she had chronic pain. She had sciatic pain because the nerves from the lower back go down into the legs, and this is our post-X-ray after a course of care. This is an example of surgery. When the discs finally get like this and they're so bad, the medical approach is to fuse the discs up. Now, what do you think's better? Being reactive, letting that happen, or do you think being proactive and fixing the structure in the spine, correcting the poor alignment in the spine, straightening it up so the discs never wear out? I mean, I think the answer is obvious. The lower back from the side should also have a curve like the lower back from the neck. You should have a curve like that. When you lose that curve, the discs will degenerate and get thin. And this is a MRI, and you can see the disc bulging in here. This is the spinal cord. It ends up here, and then these are the nerves that come down through here. And so this bulging disc will put pressure and bulge into the spinal cord. Patients that have that going on can end up with sciatic pain because the nerves in the lower back put pressure. They go down into the legs. So patients with disc problems in their lower back can have sciatica. They can have numbness and tingling in their feet, weakness in their legs. For those types of patients, we use non-surgical spinal decompression therapy before we get into the corrective process. So the goal there is to open up the disc spaces and suck that bulging disc back off of these nerves and make these discs get healthier again. And then once we get them to a point where they're pain-free, then we want to correct the structure in their spine. Okay? Now, how does all this happen? Well, physical stress, emotional stress, and metabolic stress.